Are you ready? Hello, how are you? Good afternoon, everyone, and welcome to this session. Nothing closer to the people working on public health than water and sanitation. So I'm sure that you will enjoy. My name is Maria Neira, and I'm the director of the Department of Environment, Climate Change and Health. And as a medical doctor, for me, when I started my career, always looking at whether we will have water, sanitation, waste management, and hygiene as the basis to start. If you don't have that, then there is no public health. So I'm super converted and very happy to be here with you today, and happy to attend this meeting, and happy to pass it to Kate Medlicott now, who will be moderating. Kate, over to you. Thank you very much.
Thank you, Maria. And you'll be seeing more of Maria on the panel shortly. But first, what I would like to do, well, first I should introduce myself. I'm Kate Medlicott. I'm the Sanitation and Waste Team Lead from WHO in Geneva. Maybe I'll switch microphones. Yeah, I'll do that. And we want to, I'm going to be presenting with Farai, our partner at UNICEF, a quick overview of the issues of WASH, health and climate, and then we're going to go into two panel discussions. So perhaps without further ado, I will get into our presentation. So, just a moment, I'm going to... Thank you. Challenges of aging, we're going a little blind as well. Okay, so firstly I want to sort of touch on the climate risk associated with poor water and sanitation systems. And let's look at the burden of disease. So we know that globally, this is not accounting for climate change, 1.4 million deaths and 74 million deaths per year associated with poor WASH. I'll go back to this one. So that's a huge burden of disease, a preventable burden of disease that's out there. And when we're looking at climate change, you can see there's potential for this to get a lot worse. So we're looking at sort of vulnerability factors around all of these things we're seeing here, which are going to amount to around another 3.6 billion people already living in vulnerable areas, and potentially another 250,000 additional deaths per year. And of those deaths, diarrhea accounts for the largest amount of them. We're seeing cholera is absolutely raging around the world at the moment, with 29 additional countries reporting really high case fatality rates, and all of these are preventable with WASH, most specifically preventable through sanitation, and sanitation in places that we know sanitation is poor, and we need to get to the root causes of these outbreaks. Secondly, and I think you still can't hear, okay, is that better? We're getting feedback on the second mic, okay. Then vector-borne diseases is the other one. And I think we don't focus on this enough. We often think about diarrhea, but actually vector-borne diseases are really affected by climate change, hotter, warmer climates, particularly dengue, which is affecting half of the world's population, and increasingly the spread of Anopheles mosquitoes and new species of mosquitoes that are making our typical vector control efforts more difficult. So we really need to be thinking about water management. So how are we doing on WASH? We've got 7 years to the end of the SDGs, and we need to increase our pace of progress by 3 to 6-fold. It's enormous. We've got a huge challenge in front of us. And climate change is just making this challenge even harder. From UNICEF's data, we see that 1 in 3 children are exposed to severe water scarcity, 270 million children face a high risk of drought risk, and 236 million children are exposed to extreme water vulnerability. So the WASH challenge is exacerbated hugely by climate change. So I think countries know this is coming, and they need to think about how do we adapt our WASH strategies and plans. And we see challenges there as well. So at the national level, we see from the GLASS data that around 72% of countries have integrated climate risks into their WASH national planning. But it's only around 20% of countries that are actually implementing climate preparedness and response in their WASH programs at a significant scale. So they're getting started, but there's plenty of work to do. I wanted to dive a little deeper now into 3 specific areas of work that we have as WHO and UNICEF around climate resilient WASH. So at this moment, I'm going to hand to Farai, who's going to talk about the Water Security for All initiative.
Thank you very much, Kate. So I will talk about water security. We have seen the data which shows 1 in 3 children, and I'm trying to figure out how to navigate this amazing tool.
This one.
Oh, super. Thank you, Kate. So very quickly, when we talk about climate resilient WASH, it's really good for us to become up to date with what has been happening in the sector. For those who were here last year, we did dig deep quite a lot into the climate resilient WASH framework, and I hope it's now a handy tool that you are using and applying. So just to reflect back, in 2015, UNICEF and Global Water Partnership, we launched the climate resilient WASH framework. 2015, we are in 2023 now. And to date, about 81 countries are reporting, actually applying the framework in different ways. We are also learning from that process some of the challenges around applying the climate resilient WASH framework. And in 2020, we then further developed that framework, and we developed a 9-step guide trying to address some of the issues that had come up and really try to put some structure into a very complex process. As UNICEF, we also then committed to what we call the climate resilient WASH shift, and it was our commitment using our resources to work jointly with the sector so that the sector would also transform. So you will see that in most of the countries that we are working, we don't work alone. We actually work with the government, partners, NGOs, civil society, so that we achieve that shift. On your right side, you can see all the different documents that have been developed. We have a lot of guidance notes, the strategic framework itself, and I would recommend that you try and take a look at these documents to understand a bit more about the climate resilient WASH shift. Now, when we elaborate and really look into the results, for UNICEF, we define the shift being achieved when the three indicators that we have put up are satisfied. So the first is your country actually applying the climate resilient WASH shift? And then we try to understand to what level. We also reflect upon whether you've developed your climate rationale. And the climate rationale is the link between the climate risks, vulnerabilities, and hazards that you experience within your country or the locality that you are developing solutions for, and how that is linked to the solutions. And a lot of trying to apply the climate focus, and there we still have a lot of work to do. We also then look at whether you have articulated the different elements of WASH services into your national data systems. And you will see there's a lot of progress, but a lot still needs to be done for us to achieve more. When you look in the 2022 results, only 13 countries globally, out of our 130 countries implementing, were able to hit the mark on all the 3 targets. So there's certainly a lot of work that we need to do for us to achieve the shift in countries. When you look at our general criteria for climate resilient WASH services, we have been so far looking at the risk analysis, so integrating our climate risks into the work, understanding them more, and really saying, what are we dealing with? Is it a flood, a drought, both? How intense is it? Where is it? and what are the implications. We are also looking at whether the services are reliable at all times or we can quickly reinstate them, because sometimes it's impossible to really have that sustainable supply, and it could be around your seasonal changes, extreme weather events, and so on. So water security is a big issue. It could be also we are depleting our water resources and they are not able to bounce back as fast as would like. We are also seeing shifts around management and service delivery models. In some areas, they are becoming more complex. So a move from a lot of our community-based managed systems to some quasi-utility type models. And that also means we need to look at our capacities and capabilities in those areas. But here, just to caution, complexity is not always the solution, but sometimes we have no choice. And then also considering the impact of greenhouse gas emissions. Just to say in terms of the definition, we are having a broader conversation through the SWA Climate Task Force around how we can move stronger and faster towards a common definition right across the sector. And we have also used this particular definition to support the SWA submission into the Global Goal on Adaptation, which is under discussion for now. We have, as UNICEF, another initiative which we are working with countries, partners, governments on, and it's called the Water Security for All Initiative, and it's really aimed at addressing the 439 million children and their families that live in areas of high to extreme water vulnerability. On this map, you will see the darker the browns, the extreme the vulnerability. And as you can see, we have vulnerability on almost every continent. So this is really a global issue, although we see Africa having some of the biggest burdens in this particular area of work. In terms of our approach, we are looking at 4 packages or approaches that are applied in different ways, starting off with what we call the shift, which is moving from business as usual to climate resilience with a policy approach, but also trying to understand our risks and vulnerabilities. And then we are looking at catalyzing resources into the sector, so using our domestic resources and leveraging those with climate finance, and then scaling up our interventions, be it on infrastructure, but also through our service models. And of course, the green transition, where we want to see a low carbon sector from the water perspective. So I'll hand over to you, Kate, to take us through the exciting work on sanitation.
Thank you, Farai. And some of you might be thinking, as I think many people were just a couple of years ago, what has sanitation got to do with climate? And I think it was quite a widely held thing, but we're seeing through the work of the Climate Resilient Sanitation Coalition, much clearer articulation of what is the issue and what we need to be doing about it as a sector. So first, just to say that, where we have poor sanitation and the worst effects of climate change are being felt, they tend to overlap. But in fact, all sanitation systems are vulnerable to the effects of climate change, with sea level rise for low-lying wastewater treatment plants, to the effects of too much or too little water on sanitation systems. Too much water, meaning that we have these overflows of waste into communities, putting everybody's health at risk, and too little water, meaning that often these systems cease to function if they're not having enough water to move excreta through the system. So all of these investments are under risk. Billions of dollars of existing investments out there in sanitation infrastructure that's at risk of being damaged or destroyed as a result of climate change. And these are precious investments. It's very hard to get investment in sanitation, and so we definitely don't want those investments to be lost to predictable climate threats. The second is greenhouse gas emissions, and this is quite different from the water sector. The most recent estimates are showing that it could be as much as 2 to 6% of NDCs methane specifically is coming from sanitation systems, which is quite a shocking finding. And particularly in Kampala, one study found that perhaps up to 50% of the emissions from the city was coming from sanitation systems. So it's a big contributor that has previously not really been in the picture. When it comes to human health and freshwater ecosystems, of course, when sanitation systems fail, we have untreated wastewater getting out in the environment, exposing drinking water, irrigation water, recreational water, causing eutrophication, cyanobacterial blooms, fish kills, and additional emissions. And then when we look at our marine ecosystems, many of them are being undermined or even destroyed by unmanaged wastewater discharges, and these are going into areas where you have mangroves or seagrasses, which are in fact very good sequesters of CO2. So our sanitation systems can, if not managed well, can actually be destroying some very important carbon sinks. So then when we turn to the situation on financing, there's a vanishingly small amount of climate financing that goes to sanitation. It's so small, it's close to zero. Yet with this emerging evidence on emissions, I think we can start to build the case for why there should be a greater chunk there. And similarly, when we look at the policies, we see that they're often mutually exclusive. So we have, a reasonably large percentage of countries that don't really reflect sanitation well in policies, and likewise the financing also not reflecting sanitation well. So we have some way to go. Within the coalition, we have this joint objective of trying to have sanitation better reflected in climate policy, but also have the vice versa of that. And we have three main objectives that we're working as a group of more than 20 organisations. The first is around the financing case. It's sometimes a shame to put the financing first, but of course that's key. We want to increase the prominence of sanitation within climate policy and make sure that we're building capacity within country programs to deliver on that. And immediately after this, we're going to be having a discussion on the development of an annex to the Green Climate Fund's water security guidelines. So I think that's an exciting development. Okay, I'm going to move now to our third topic, and then we'll get on to our panels because you've been patiently listening. Thank you for that. And this is just around healthcare facilities. Of course, as WHO, this is absolutely key to us and a big element of our WASH programming. And again here, some of the numbers are shockingly low. I mean, can you believe that 1 in 4 healthcare facilities lack a basic water supply? The thing we regularly say is, like, how can you even call it a healthcare facility if it doesn't have basic water supply? 1 in 10 has no sanitation, can you imagine? And 1 in 2 lacks basic hand hygiene, just this fundamental thing that we need to do in healthcare facilities. There's not even the infrastructure for that to happen. Healthcare waste is a huge problem. 2 in 5 lack basic segregation. And we bundle in WASH services with electricity because, of course, electricity, water, sanitation, waste management are just fundamental public services that are needed to run health facilities. I won't go into this one too much, but of course, we need to reduce costs of healthcare and save lives by preventing people needing care in the first place through WASH at home, but also better care when they're in facilities. And it's critical to delivering primary care and for the safety of patients and workers. And there's just a growing crisis as we getting ready to respond to climate emergencies to make sure our health facilities are ready to meet that challenge. And at COP just 2 years ago, there was over 50 countries agreed to work on this, and we also have a new declaration on health at this COP. So I think that the momentum is growing here. what's more, this is actually quite an achievable thing. We know from the recent global report on wash and healthcare facilities, the cost of having wash and waste management in healthcare facilities just amounts to 60 cents per capita per year. That's really not a big investment. It's doable. And most of that cost is absorbed through, as you can see here, through the healthcare waste management part, which is the most expensive and difficult aspect. When it comes to WASH, we have the WASH-Fit tool, which is just a really practical approach that countries can use to assess healthcare facilities and identify the investments. And many of those things are low-cost improvements that can be put in place quite easily. And we're increasingly seeing all of this through a climate resilience lens. So I'll just point you to the WASH-Fit tools and technical guidance for anybody who's interested to go further on that. But for now, I think more importantly, we'd like to get to our panellists. So if I could call Dr. Maria Nera, she's the WHO Director for Climate and Health, Dr. Barbara Botos, the Ambassador at Large for Climate from the Ministry of Energy of Hungary, the Honourable Minister of Water, Sanitation and Hygiene from Madagascar, and I think maybe Dr. Bapon has not arrived. No, okay, well, if he comes in, we'll try to bring him in. Excuse me. Okay, I'm going to start with you, though, Maria, because you take that one.
Thank you.
We'll get there. Maria, you're a medical doctor, of course, and you've been working with WHO in the climate and health space for many years. I think this is how many COPs is this for you?
I don't even remember. I don't want to remember.
Right, of course. But we know that, the health agenda that WHO has been working on for many years here, and many of our global goals on health depend on basic prevention through WASH, and we're seeing some big outbreaks around the world. What's your sort of impression about the state of the situation and what we can do about it?
Let's start with the positive. Thank you, Kate. And I see that you're having a terrible time with the logistics. It's not very friendly, but I have the same problem. See, anyway, very happy to be with you and with my panelists. And let me start by saying that I'm sure by now everybody knows that finally we got a health day at the COP agenda. That was on the 3rd of December. We have been fighting for many years, attending many COPs, and finally health is inside. And when I say health, I intend that by bringing health inside, we are bringing with us the need for WASH at the healthcare facilities. I think is a kind of must, because we will never have health if we don't have the basic services of WASH, at least at the healthcare facilities. So that's something that we feel happy about it, although it's really a shame that it took 28 years to finally have a health day at COP. And my hope is that we will not have many more COPs. I mean, we should be able, if climate change is one of the biggest challenges that our society is facing, I think we should have a little bit more the sense of urgency and not needing yet another 28 COPs to solve this problem. I hope that by putting health at the center of this, we will accelerate the level of ambition and at the same time accelerating the speed at which we have to respond with this sense of emergency. Cholera, when I started my career, as you say, as a medical doctor in refugee camps, cholera was one of the outbreaks that I was facing regularly. So for me, it will be a kind of horrible frustration and depression to see that the number of cholera cases is increasing again. And I'm afraid this is the case. So clearly, climate change can be the one that will touch and destroy all of those achievements that collectively we have been achieving. One of the main recommendations that we do on the climate change is that we need to at least take advantage of putting recommendations in place related to health, which are common sense and the non-regret interventions, the non-regret investments. And what is the non-regret investments for climate change and health? Investment on WASH, definitely, on water and sanitation, particularly for our healthcare facilities, but in general. I think this can be the opportunity, and we need to join forces on this, to make sure that this horrible gap that still existed, the one that you have described on billions not yet having access to safe water and sanitation, this is the time to invest on the non-regrets, on the basic, on something that will give people peace, less conflict, because we know as well that water scarcity will be one of the causes of displacement, of conflicts and all of that. So if we can join our voices to say, one of the good things to do with the discussions at COP on the loss and damage, on other funds and mechanisms for financing that they will put in place, if they can achieve and cover that horrible gap that shouldn't exist in 2023, I think that will be one of those great no regrets interventions. No one should be no one should say, well, if climate change was not as dramatic as we thought, we spend our money on something that it was not useful. That for sure will be a very safe, wise, and strategic investment. So I will go for that. Join forces at the climate change, making sure that we advocate for having as a public health, basic public health on the health data that is now very well positioned, insisting on closing that gap that is creating so much problems for the health of the people, and it will be only aggravating in the future. Thank you.
Wonderful. Thank you, Maria. And I want to turn to Barbara now. I might come back to you on some of those as well, Maria. But, you know, we're making this case, and it seems so obvious, right? It seems so obvious with these basic WASH services, yet we see the progress is alarmingly slow. You know, with or without climate change, we struggle to get these investments, we struggle to make the case, and yet we know, for example, with sanitation, a small loss in sanitation service means that everybody's exposed, so the losses are disproportionate, really, to the health impacts are disproportionate to those losses. So I'm curious. You've also been coming to COP for some time. Are we making the case right? What do we need to do to be better heard? Is this a water COP, or are there other kind of things that are driving the agenda? What's your advice to us as a sector?
This is my 16th COP, so for quite a long time I was following this subject. And you know, I mean, in 1992, two very important conventions started. One where we are sitting right now. The other one was on biodiversity. 2 years later, the convention combating desertification started in 94 on the recommendation of the Rio Summit on Agenda 21. And there is no water convention. So with the Netherlands, with Tajikistan, Hungary has been really fighting for putting water on the spotlight. And now we have a new convention starting, plastic pollution, which is amazing. But water is basically the bloodstream of life, bloodstream of ecosystems, the bloodstream of economy. I wish the guiding star that we are talking about in global stocktake in adaptation would be water. We talk about so many things, increasing adaptive capacities, but the connection point between all these conventions and all the work we are doing here is basically water. And what we need to really see is the fact that we are all streams, all work streams are interconnected. And interconnectedness means that if we have progress in one stream, we can have progress in the other stream. If we don't have progress in one stream, we cannot have really progress in the other streams. What we say that we are only as strong as the weakest among us. If we don't really focus on this topic, probably we will not reach development in most of the other topics. I said water is the bloodstream of life. Let me say something else. Water is the superpower. The superpower which can respond to the global warnings of emission reduction and adaptation and resilience. So water is the key for achieving our targets for net zero sustainable development. And I love this sentence, but I think this is the most beautiful sentence, that if we take care of water, water can help us take care of climate. So I wish it was a water cup. Definitely it is not. Unfortunately, it's not. This is about, the main topic is right now, if we can anytime say the phasing out of fossil fuels, or it will be a weaker language of transition away from fossil fuels. You know, this abated, unabated nature is in the center, but let's not forget, water is the bloodstream of economy. Water is the bloodstream of energy.
Thank you so much. And I'm going to leave you to think on this for a bit, but if you kind of cast your mind to the next COP, I'd be curious to come back to you and think, what could we say or do differently that you think might you know, be a game changer? Because we make these arguments, but we need to find out, you know, how they can be really heard and embedded in some of these documents. But turning to you now, Minister, I mean, we had a wonderful day yesterday at the Madagascar Pavilion on WASH, and clearly, you know, you're facing a whole range of climate threats. I wanted to sort of know, what are your key learnings on water scarcity and water security and the response to climate change for Madagascar?
Sorry, can you repeat?
So what is the kind of your main responses, the main challenges you're facing and the key opportunities for response?
Yes, thank you, Kate, for your question. First, it's my first COP, and I'm sorry for my skill of English, but I will try to do my best for this. So for yesterday, we have a WASH day in Madagascar Pavilion to see. I say it's the first edition of WASH Day, and we can change with everybody to see the situation to share the situation of WASH Day in Madagascar. The key response of Madagascar and the challenge for Madagascar is, you know, as we say, climate crisis, water crisis, and if Madagascar has many water resources, but we are one of vulnerable countries that we have impact of climate change as flood, as drought. So the main response, the main response that we do, I think, first for the government and for all stakeholders, we must do update for many things, many frameworks for us to take account for the climate resilient, this mindset climate resilient, because we have many things to do for update as our policies, our legal framework, and we must sensitive also everybody, all stakeholders in our country from this COP, because as I said, it is my first COP, but first COP as Minister of Water and Sanitation and Hygiene. I see many things, and I think many sharing with all level as to share the common vision with this climate resilient. Thank you.
Wonderful, yeah, and I think one of the things that we often talk about is looking at existing water and sanitation services and how do we make them, you know, more resilient. But in some cases, including in parts of Madagascar, there's people who haven't received basic services for the first time, right? So it's not just about looking at existing services and adding on some resilience, but really making sure that we're not leaving behind people who were not able to get, you know, basic services in the first place. I'm sorry, I'm really doing a bad job with this technology. Thank you all for your patience. So I'll just sort of quickly return to you, Barbara, to that question. If you could give us some advice for next year to get our water voice through into some of these large discussions, what would you propose?
I think what happened in March, the United Nations Global Water Conference, was bringing a lot of attention and also to the connection between water and health. So that was a milestone, and the global leaders on water are still active in this respect. And hopefully we will have a United Nations envoy on this topic who will not only embrace water in itself, but the water-health connection. So we really need to be vocal on this, and visible. And what we just said at the first ever Health Day, we had to wait for the 28th COP to address this topic during a sectoral day. I think that's an amazing result. We should continue with that. That can bring a lot of focus. And let's not forget about innovation and technology. I think a lot of countries have technologies in water sanitation that are essential for hygiene. And what I can say is the most underestimated sector is the healthcare system right now. What you've been talking about. We really need to have increased the pace of progress, 3- and 6-fold, as you've just said in your presentation. When we are making a new project, what is the first thing we do? We are doing an environmental impact assessment. That's the first thing, but it's always twofold. When we are building a healthcare institution, then we are talking about to what extent it is exposed to climate change, and to what extent it contributes to climate change. So healthcare system contributes to climate change. Let's be honest, they contribute to CO2 emissions, wastewater, hazardous waste, but at the same time, they mitigate the impact of climate change by taking care of the health of people. And a recent study has also shown, and we have to raise our voices and be vocal on that the biggest threat to health workers is climate change itself. And, we are talking about just transition. Just transition is nothing else but the social and economic effects of energy transition, but really have to talk about the adaptation side of it. When we talk about resilience, there is also a sort of just element. Things will change. I was on Health Day, we were addressing this topic, and it was a very interesting information saying that 85% of the jobs that will exist in 2030 have not been invented yet. That's shocking. And that's shocking. It might not be 85% for the healthcare system, but let's say 50, 60% with technology, with artificial intelligence, with all the innovations we have, with all the sanitation technology that we have, how we can filter water, how we can produce drinking water from the most polluted water. This exists, but there will be a big change in the healthcare system. So are we prepared for that? Is there a transition for that? Are we there yet, or there is a long time to be able to see these huge challenges that are ahead of us? And this is about life. So health is the face of climate. So this is very important. So we are basically providing all of us the face of climate, because human health is the biggest treasure that we can have and we have to protect. So next COP, let's be vocal. Let's have a health day. Let's have one day on water, with some connections on health, and one day on health, but also with a lot of connections on water. And let's have a lot of decisions made. I'm so proud because at COP27 in Egypt, in the cover decision, within the European Union, it was Slovenia and Hungary. We were really fighting for having a language on the connection of water and climate change. And we had it at last, but we had to fight for that. Mm-hmm. So let's have this triple connection, this triple nexus of climate change, health, water. The health, as I said, is the bloodstream of life.
Wonderful. Maria, I will just come back to you one final comment because, well, firstly, congratulations for this huge achievement of having so many ministers here and the declaration. but there's so many health issues there, and many of them within the health sector, right? You're always making the case for prevention and for working outside the health sector. How do you see that happening in the follow-up to the declaration with the ministers to get this in the agenda?
In so many ministers and the declaration and all of that is obviously a success, but this is not the success. The success is the fact that now you will have the voice of the health professionals raised on a very loud and clear way saying our health is affected by climate change, and therefore we need to adapt and we need to mitigate. I think we should not forget mitigation. I think it's extremely important to have a balance on the two and use the health voice to say, close the tap. I mean, the one that is causing flooding. So we need to reduce emissions, and we need to remember and make sure that the negotiators remember that this is about reducing emissions. If they could stop completely the emissions, will be even better. But if they stop the emissions, if we reduce emissions, one of the immediate benefits will be on water and will be on health. So that's why we need to keep advocating very, very strongly, using the voice of health, the voice of water, the voice of everyone who is very vulnerable, to keep fighting for mitigation. Don't forget that, and don't allow anyone to take it away and distract us with something else. The second thing is about adaptation. Of course, we need to adapt. This is happening already. And why we are using the voice of the health community for that is saying adaptation means climate resilient healthcare facilities or health system, which means a climate resilience healthcare facility needs to look at the use of water and water efficiency and water use and sanitation, and as I say, basic no regrets investment on water and sanitation. In addition to that, climate resilience means as well that we need to invest on those healthcare facilities that at the moment they don't have the capacity to have water resources, and we need to move very strongly on that and do prevention. If we prepare our health systems to cope with the consequences of climate change and become resilient, that means that they need to be prepared to waterborne diseases, to vector-borne diseases, to malnutrition, to mental health problems that will increase. You will have more cases of dengue, more cases of malaria, more cases of cholera, diarrheal diseases. And this is where we need to make sure that this climate resilient healthcare facility, the new health systems that we need for the future. Plus, as you rightly say, the health sector is a very demanding and we produce emissions. We represent the health system 5% of the global emissions. Obviously, middle and high-income countries, the low-income countries, they are not contributing at all. At the contrary, they need to gain access to electricity, but we should do it with sustainable sources, with renewable, with solar. But for those who are, we are already contributing the 5%, there is a group called Attach, where we are trying to collect all of this knowledge about decarbonizing the health system. And this is an initiative that goes in line with what you say about the jobs in a few years from now. Because if we want to reduce emissions of the healthcare facility, we need to look at supplies and procurement, plastic use, you know, all the material we use of the healthcare facility, which is huge for obvious reasons, but we can reduce it dramatically. A small innovation like inhalers, you know, for asthma, now you have different presentations. So little innovation is coming every day. The second thing on reducing emissions of the health system will be healthcare. And the third one will be telemedicine. So the jobs you were talking about at the healthcare will be probably related to that. Not all the patients need to go to the health facility. They can do it, and that will reduce a lot of emissions, a lot of use of material, and maybe creating those new jobs that you were talking about that are green and all of that. But don't forget that, the basis of our life will be food, clean air, and water. If we don't have these three things, I don't know what else. I mean, it's better that we go home and we pray for, you know. But the three things are so much connected: the quality of the air we breathe, the water we drink, and the food we. And if we don't have water, normally we don't have agricultural production either. So my point is, we are together on this. So it's health or the health argument, whatever is more powerful, let's push, and then let's be very, very vocal and very loud, and not accepting to have COPs, even if they have a special day on health or a special day on water. That's not the answer. The answer is action. We don't want more COPs. We want COPs that take action. Sorry, if this goes on Twitter, he say we don't want more cops. True. I mean, if we don't have more cops, means that we solve the problem. At least I don't want another 20 more cops to talk. If this was a health issue, the cop, we will not be here. If we don't deliver in 6 months, imagine a health crisis, and you keep going for years. No, we need to talk. We need to negotiate. Excuse me? I mean, and then we will all be dead. So provocative. Over to you, Kate.
Well done. I'm going to thank you, Maria. I'm going to give the last word to the Minister from Madagascar. You are sitting here with two veterans of COP, and this is your first one. So what is a key lesson you are going to take back?
Yes, I am very surprised to follow their discussion. But for me as a minister, when I follow the scope thematic in COP, I think the one of solution is how to increase the right of access right about OSH. And the answer is you must find investment financing for all actions. So I want to share with you the situation in Madagascar about this financing investment in OSH. First, the government must improve the attractiveness and competitivity of environment, because the one of the parties, I think, who must invest more and accelerate the changement about this is the private sector. Mm-hmm. And in Madagascar, it is, I think we are going on this, but we must go fast. Yeah. In 2023, government has adopted the framework about the investment in general, but we think to update also the framework about the water law for this. And we have one model with a partnership with UNICEF in the small scale, in municipality scale, that the model is private sector work with the partner, technical and financial partner. What is the model? Manager, investor, builder. Mm-hmm. And MAB apport about 20% for the cost of investment, and the partner apport the rest. And MAB, manager, investor, builder, manage these infrastructures for 15, 20 years. That is the one way we find, and we have success for the last 5 years ago about this, and we think to multiply, to find another way to extend these best practices for the private sector and partner and government. But the responsibility of government is to secure the investment and also to shape the market. Mm-hmm. Because I can say the private sector is not habitual to invest in the water sector. So the government should shape the market to help the private sector to see what is the opportunity of business in business about the water sector, and we can help us to go fast, to accelerate. And in all of this, they must have the idea about the climate resilience. I think it will be new thing, new size, in all model business in Madagascar about the climate resilient in our sector. Thank you.
Wonderful, thank you. I'm so tempted to ask all of you more questions because it was such a pleasure to have such an esteemed panel, but we need to move to our second one. So a round of applause to you all, thank you. And I'm going to hand over to Farai to lead us through our next panel.
So the message from this panel is, let's talk more action. And I think it's a nice segue into the next panel, where we are going to be talking to people who are at country level, trying to apply this concept of climate resilient wash and really trying to make the change on the ground. So I will call our panelists. Our first panelist is Safiria Tagivuni from Fiji. We also have with us Juliet Willets from the University of Technology. We've already heard a lot about technology and how it can play a part. Thank you, Juliet. We also have Kate Nimanya from Water for People, and that's exactly where we want to see the water, with the people. And lastly, we've got Sarah Gonzalez, and Sarah will talk to us particularly for the young people, because they are really the custodians of what we are trying to do here. This was not by design, but we are quite grateful to have a lot of women on the stage. Just to share particularly on that comment on women, I was in a discussion with the government of India, I think about 2 days ago. And one of the things we spoke about was that 7 out of 10 women are responsible for the collection of water. And with the climate crisis, the amount of time they are spending doing that has grown so exponentially. So my first question to you, Safira, is particularly on that reflection around women and climate. Safira, we know you come from Fiji, and Fiji is an island state, and climate change is something that they live with on a daily basis. And you've experienced it maybe earlier than any of us could start talking about climate change. We also know, Safira, you work for a women's organization, and you have quite a huge focus on WASH, and more importantly, climate resilient WASH. What lessons can you share with other people in this room, particularly around the early stages of implementation of climate resilient WASH? In particular, what are some of the opportunities that you've seen in this space that allow us to reduce the inequalities that we see women facing? Safira, over to you.
My name is Safira Mbamba Tangivuni. As he mentioned, yes, I am from Fiji, from a very small island to the eastern of Fiji, which is called Lakemba in the Lau districts. There are 19 small islands out in my province. Yes, of course, I'm here because of Omega Holistic Institute, and I just want to thank them for bringing me across here to voice the work that we're doing back home. Yes, 20 years of existence, our NGO, and we've been working with communities, especially when we visit communities, we identify what's a sanitation program that we can assist with. Yes, we have assist with building their flush toilets for those who have enough water, those in the inlands or the inlands communities because they have rivers. So we bring the rivers to their homes and have built flush toilets for them. And for the communities that they have not enough water, we build pit toilet and use straws and ashes to help them so that they are private when they're doing their thing is using the lavatory. We have a community who's been relocated to Fiji 70 years ago. I happened to be in this community island during COVID because I went there because my second daughter is a medical doctor. And she was posted there during COVID. I couldn't do much. I couldn't do anything much because we were given the last boat to travel. So in that community, I make use of the stay during lockdown, and I went around to all the community. It was surprised to note that we were asked if we know that this community have a right to no toilet. These really bring me into a lot of concern. So we did awareness around in the island. We're still looking for bathrooms to help these communities so that they can, for those that haven't got flush toilets, they have water, but they don't have flush toilets. So we're still looking for funds for that. And the work that we're doing for the women in my communities is like the climate crisis in my homeland is really every day. That's what we live with because we can have sunshine today and we can have cyclone in the evening. It's something that we have to live for, and the women are in the front line of this. To be frank, because the women have to find food, the women have to find clean water, the women have to look for the clothes and everything ready at all times. In fact, we have buckets ready with us that we have to fill in with food and clothes and ready for a situation like that. So when we do awareness to all these communities, we made sure that they are well prepared for situations such. But my second part of the questions is for resilience. Yes, we do take care of all these, we do awareness and capacity building in all these communities as we do disaster risks management to prepare them for situation and such. We take down trees that are resilient, fruit trees that are resilient. This goes together because of our work with the emission reduction program through carbonization. So we managed to have nurseries to plant fruit trees that are resilient during cyclones so that they can plant resilient crops and resilient fruit trees. Yes, and we are very mindful that the relocation center or the community centers that evacuation centers that are built are not gender friendly. We need to look into, we're making plea to our government and to funders if they can, when they are planning to build a relocation center or evacuation center. We have evacuation centers everywhere in Fiji so that they get ready to be relocated or evacuate to go to during warnings. Whenever we have warnings, the families are taken into the evacuation center. But they are not gender friendly. We have one whole room and we have just two set of toilets. And yeah, the kitchens are not inside. Thinking about gender issues here, where will the women prepare the foods, and the women and the men and everybody are sleeping together in one whole room. So we are looking into designed evacuation centers that can do partitions so that there is separate rooms from men and from the women and the children, and we have the inbuilt kitchens, and we have more bathrooms and toilets. These are realities that we're facing down on the ground, that we would like to see that it take place in our communities, not only in Fiji, in the Pacific as well, because we're facing this right through the Pacific, and I'm speaking here as the only voice from the Pacific, and I'm mindful of that. Yes, that's exactly what we are facing down there on the ground. My NGO are big on health issues. We're big on health food demonstrations. On any health issues, we're big on, we're talking about resilience. These women, when it comes to sanitations, if they can make their own soap naturally, would really appreciate that, so that there is not much pollutions coming in to them. We need them. If they have to be efficiently provided with sanitations, then they have to make their own soap, their own lotions, and their own naturally, which they can do, but they lack funding to do that. We have the natural materials to do that. Thank you so much.
Thank you, Safira. I think a key message coming out from your intervention is really the need for us to be gender sensitive as we reflect upon all the responses that we put in place. Thank you for sharing that situation in your home country. I know it's quite a tall order to be carrying all of that, and I'm sure your constituents is very happy that you've put forward their position. Moving on to you, Juliet, I understand sanitation beats the aviation industry in terms of emissions. Juliet, tell us, what is the latest research around sanitation, and how can we strengthen the climate rationale so that when we are sitting in COP and talking about sanitation and its value, particularly to the mitigation conversation, we will get the attention that we need for us to have sanitation in place?
Thanks, Farai, and thanks for the opportunity to share some thoughts on that. So the emissions story for sanitation is an interesting one that, as Kate referred to, the emissions are much higher than what we thought, and a lot of the data that was originally captured was just for wastewater treatment. And we know that that's some tiny proportion of actually what happens to human waste, because so much of it is unmanaged or it's in on-site systems at the household level. And so the emissions, as researchers have started to look into it more recently, have realised it's much higher than we realised, and that we need to start planning our systems in ways that can reduce those emissions. And so in this study that Kate referred to in Kampala, it was as much as 50% of the whole city's emissions. So at that point, sanitation can perhaps get onto the agenda. It's not 2%, it's not 5%, it's 50%. But emissions isn't the only reason why sanitation is important for climate change and around the interrelationship. It's also around resilience. We recently did research in Indonesia in 4 cities, and just looking into what the different impacts were of floods, of drought, of storms, and of sea level rise. And we found that many, many people were suffering without sanitation during those events and after those events, that we don't yet have the systems that bring back those services, as you mentioned earlier. We're not equipped. We haven't yet made sure there are alternatives that people can use during those times that they don't have access, and that we need to forethink these things. As you described earlier about evacuation centres having places for women and men, we need to make sure there are public toilets or toilets in institutions that people can use when their household facilities aren't available. And that's not rocket science. It's not something that's out of reach, that's beyond our capability to provide. It's just a set of prioritisation, of financing, and thinking ahead and making those plans. So the other area I wanted to bring up was on wastewater and wastewater reuse. So wastewater, we know, is a huge resource. It's something that we can mine for the nutrients, for the water, and yet it's slow in terms of being taken up as part of what is done. We know there's a lot of informal reuse that happens in agriculture or in other ways, but that's not necessarily safe. It's putting potentially pharmaceuticals, pathogens into our food chains. We need to actually manage that process of wastewater reuse. And when we can do that, then sanitation will really be able to be making a contribution to broader community resilience. So maybe I'll leave it there.
Thank you, Juliet. I like your link between sanitation and broader livelihoods. And I also like the link, if we get our sanitation right, then we can also get our water systems flowing with the right quality of water. So, Kate, as I move to you, very much now trying to bring the conversation to water, because we've really understood a lot of the issues around sanitation. My question to you is, how is Water for People changing its program approaches to incorporate climate change, and how has that been going? What are some of the challenges but also opportunities that you see within Uganda?
Thank you very much. Just a small correction. I'm not the country director, Water for Uganda. Yeah, I was actually a country director, but right now I'm a regional director for Africa.
Okay.
So
Congratulations, congratulations.
thank you. And yeah, this is my first COP. So glad to be here, and thanks for the invite. Yeah, Water for People, it's a US-based NGO. We work in 9 countries, 4 of which are in Africa. That's Malawi, Uganda, Rwanda, and Tanzania. And for many years, we've focused a lot on wash service delivery. We do partner with governments, both at the national level and the subnational level. And as an organization, we've witnessed firsthand the effects of climate change. From our country programs in Malawi, you've all heard about Cyclone Freddy, where villages were actually washed away. That means the whole infrastructure goes together with a village that has been declared open defecation free. So we've had to rethink quite a lot. In the past year, we've just launched our D30 strategy, where we feel that by partnering with like-minded organizations like IRSC, WASH, we can be able to reach more people, but to also pick from skills of one another to be able to tackle the challenges with climate change. And as entities, we do believe in systems. So WASH system strengthening is something that we are ensuring that we incorporate in all our programming. And looking at climate resilience or climate change, we've had to make modifications on most of our infrastructure designs, as well as the businesses. In some of our countries, we've focused quite a bit more on point water sources, and now moving more to reticulated water systems where we adopt solar as a source of energy. We've made improvements in our drilling so that we are able to get enough water that serves maybe multiple villages, rather than focusing on one. We've done quite a bit of design models for flooding. And we believe that it's not just actually the infrastructure, but how do you support governments then to design guidelines so that, yes, you showcase in one location, but they're able to do more, working with them. We've been supporting a lot of service delivery in other areas we do work. What happens after that infrastructure has been constructed? There's a lot more that is related to sustainability, and we've incorporated water resources management or climate change, looking at groundwater monitoring, using latest technologies like sensors, working with utilities as service providers. And we've done quite a lot on proving different concepts or management models In Malawi, we are working with government to pilot some of these management arrangements. In Uganda, we are supporting in piloting of the O&M operation and maintenance framework. All these not focusing on just one pilot in one village, but how can we work together as a sector with other development partners so that we are able to focus on reliability, especially of these water services. And I would also speak about risk-based planning. Thanks to UNICEF, we've been able to get tools that are available. There is a lot that is available. We don't have to reinvent the wheel. And we've used these tools to assess the risks at national level, supporting governments to develop the strategies, but also to start applying the risk-based planning at the district local government level. So we're working with close to 40 districts in all together, and we believe that we shall get there if we work together with partners. And how does this fit in government action plans? We know governments have done, especially all the governments we do work, they've done risk and vulnerability assessments, and they've prioritized certain areas. So in Uganda, for example, it's droughts, it's floods, it's landslides. So working with government to prioritize, to showcase and pilot certain approaches, then we're able to work together, learn together, coordinate with other players, and hopefully we can be able to go to scale. So I would stop here for now.
Wow, I think we always think that NGOs do a small thing here, a small thing there, and we also think often that they don't work with government as closely. Minister is nodding, so I think I'm hitting the right buttons here sometimes. Now, my question to you is, what has made it possible for you to work so closely with the government? If you can just elaborate a bit around that.
I think being intentional. As NGOs, we cannot replace governments. That's what we always say. So however good a project is, if you're not intentional in terms of appreciating the institutions that are in place that are supposed to carry over the work once you're gone, then so for us, it's really being mindful and being intentional and appreciating the challenges of governments, because most times we say government is slow, it's bureaucratic, but appreciating that that's the context you're actually working in, and then you're able to walk with them on that journey. And it takes time. Most of our projects, we do remain in a district for quite some time, so giving it an opportunity to learn and then also build trust, because trust doesn't come after 6 months or 1 year. It takes a lot of time. Thank you.
Thank you. I'm quite glad to hear that the tools that we are seeing in the field are actually working. I will turn to you, Sarah. You are a young person. I always look, yes, as we can all see. You are a young person, Sarah, and you've been to COP a few times. And would like to hear from you your reflections and your impressions, having listened to the first panel and this panel around the path that basic water services is taking. Do you think we are doing the right things? This is your chance.
Well, first, sorry, because I think I am so close to lose my voice. So normally
she is young. She is young. We can see.
So, and I am so excited for spoke after you. Well, I am from Costa Rica. I want to know who knows where is Costa Rica. Please let. Okay. Yes. It's more than yesterday in the other panel. But normally the people doesn't know where is Costa Rica. Costa Rica is in Central America. Central America is one of the most vulnerable areas in face of the climate crisis and the environmental crisis too. We are extremely vulnerable because social, political, economical, and environmental elements, especially because economical and political. Actually, Nicaragua has a dictator, and El Salvador maybe is close to there, and our governments really takes strange ways in the management of natural resources, including the water. So when I was grew up, I listened that Costa Rica is perfect with the water thing, but actually we aren't, because in Costa Rica the people doesn't have access to the water, or the people that has access to the water but not is good and quality water, because in Costa Rica we have a lot of environmental problems that generate different pollutions into the water, and the people take this water. Actually, in different communities, the people have cancer. Is in English too? Yes. Okay, cancer because of the water, because especially the agricultural sector doesn't have the correct conditions for support the conservation of the water. So we have this problem with the loss of the ecosystem and the uncontrolled expansion of the agriculture sector that causes the contamination and degradation of the water bodies. That is the principal sources in Costa Rica for the human access water. And faced with all this lack of institutional response, because the institutions doesn't have the capacities for face the challenges and take action with the communities. So the communities take the leadership and try to give the access to water to the persons, but they don't have the capacities to. So in some case, the communities drink water that is contaminated too, because of the community can support and manage all the infrastructure for that. So this is the reality in Costa Rica and in Central America, and is work with all the climate impacts. And actually, we experiment different impacts that show us that our infrastructure for water is not resilient right now. So every time that we have a lot of precipitations and the infrastructure collapse, and we don't have water for a long time. So I think we can do different things, especially in the Green Climate Fund. So it's for you, because recently UNICEF put one study that showed that only 2% of the climate finances going for projects that is focusing children, including the water. So I think we need to put more money in projects that impact children's life, because it's the most vulnerable group in middle of this topic. So we need to increase the WASH investment, focusing on the children. Within the project, during the implementation, is focused in the children's rights. We need the mechanisms for community cooperation. Must also be strengthened, establishing basic conditions for the community efforts and generate an entire regulatory framework for public-private alliances that can be established in that regard. And we need a different process of capacity and skill training process must be generated for the communities and for the institutionalized too. Because really we need good institutions, but we need good communities with good capacities for that. For this reason, I think that work that you do is amazing and is in this direction, and really we need that in Costa Rica too and Central America. And the last one is design children-friendly climate and water policies that allows work with the challenge of the children and the youth too. Thank you.
Yes.
Thank you very much. So for me, I always look to the education system for solutions when I have tough situations like this. So Juliet, I'm going to ask you the next question. Juliet, what do you think we need to do differently on the next COP in terms of the information and data that we have in the wash sector so that we are better positioned to present our situation? Because clearly we have issues on the ground, but it's taken us COP28 to start having good conversations on water. What is it that we should be thinking about?
Thanks, Farai. First of all, I think that good communication is about relationships, and I think the fact that we have the separation of the thematic initiatives such as this pavilion, and then we have the countries over in another area, and then we have the negotiations somewhere else. I think that we need to be building lots and lots of relationships at one-on-one level and in groups. And so I know this year the Water Pavilion has this initiative called Water Envoys, which was to encourage water people to talk to other sectors. I think we need to do much, much more of that. And we need to engage much more with the countries and the negotiators and build the relationships with them, understand what their needs are for which data they need, rather than us trying to compile too much data or too complex data. Let's hear what kinds of questions they have that they need answering and be ready to respond to that.
Thank you very much. Juliet was the lucky one to get an extra question. So just building on what Juliet has just said, I think we all come from countries. We all have friends in governments. We know people in NGOs. We work with people in the water sector. There are so many networks. Are we really using them for the most? Particularly when we are trying to get our WASH message to the top. So I'm now going to move into closing. And for my closing, I'm going to give each and every one of you homework. It's one of my favorite things. And it's going to be homework around the conversations around COP. At COP, I think I'll use the other mic. Thank you. So at COP, we hear things like the global stocktake. We hear things like the global goal on adaptation. We hear things like the loss and damage, the mitigation agenda. And on this long list, I will ask each and every one of you to just listen to one of your favorite areas. And for that area, I would like you to carry a few messages coming from the WASH sector. So I will start with the global stocktake and review. This is an ongoing process. And from the WASH sector, we want to increase the ambitions of the NDCs and the NAPs. We want to see our issues coming out a lot more. We want to see WASH expertise going into those NDCs. And also we want to have a higher prioritization of water, sanitation, and the treatment, the water, sanitation, our treatment processes, and all the good things that we've heard today around reducing emissions from the sector. We also want to have these reflections around untapped opportunities for mitigation. So for those who love the stocktake process, these are some of the key messages that we have from this sector. For those who are into adaptation, livelihoods, resilience, here are some other messages for you. We know that water is central for survival. And human beings can never adapt to climate change without this very essential resource. So there's our first message. Water is essential for our survival and our adaptation to climate change. So what we want to see is an adoption of water-related adaptation targets, because at the very least, that's what we need so that we are able to conquer climate change. And as a water community, we are willing to engage in that process, and each one of you are already starting to engage when you pass on that message. So that's for the guys who love adaptation. And for the last group who love the mitigation discussions and are following those, we are a contributor to the greenhouse gas emissions as a sector, whether it's from water as we do our pumping, and we now hear even glaringly more our contributions coming from the sanitation side. So this is a message we clearly need to send, right? Because right now, when we talk about mitigation, our sector has been forgotten for so long, but suddenly we have this gold that we can contribute to that conversation. We know that these emissions are higher than we thought. So we need to start sharing this with all our friends, right? And we also need to start talking about how WASH features in the NDCs, because if it is not in there, then the emissions that we are releasing cannot be recognized. So these are some of the messages coming from the WASH sector. Please follow the Water for Climate Pavilion. It has a lot of messaging around how we can engage around COP, but more importantly, when we go back home, we need to act. We need to act now because climate change is here, and we really need to start working. So the climate crisis is here. It's a water crisis, and we have all the tools that we need going forward. Thank you, ladies and gentlemen, for taking your time to listen to us. From Kate, my co-moderator for this session, we really appreciate your time. And for the first panelist, please join us as we take our photo of the day. Thank you, and have a good day. And do your homework.
And just to add, for those questions for your homework, you can go to this link. You'll see all the key messages there. They're short, easy to read, and for all of us to use as a sector.